Yes.
So can I start now?
Yeah, fine. Yeah, we can start. No problem.
Okay. Good evening, everyone. I'm Dr. Tittu Abraham. I'm an avian and exotic practitioner from Kerala. I'm running a clinic called Elixir Exotic and Avian Pet Clinic. So currently, I'm pursuing my postgrad in surgery from Mizoram, Central Agricultural University, Mizoram. So, so the first slide itself is to test your eye. Actually, can you see what it is being written in this slide?
Yes, doctor, we can see the slide.
Okay. But the problem is you cannot see it distinctly, right? So I just made this first intro PPT like this to show the differences in the iris and different eyes that we get in avian patients. And one more thing is to show the importance of our eyesight also. So with this different types of images, you will not be able to distinguish the format that I have written. It is very difficult to distinguish because of the mixed coloration. So it will be better in the next slide, like this, right? So it will be able to read it very properly. It will be soothing to your eye also. So just to give the importance of that special sensory organ eye of birds, I've made that first PPT. So this is just for an understanding. I'm not making it any complicated because there are students also from veterinary faculty.
Okay.
So just to know the basics of this eye, so what I'm talking about, which area is affected, just to know that I've made this PPT. Okay. So for birds, there are three types of three shapes are there for its the eyes are of three shapes. One is globular, another is flat, and the third one is conical. So conical is found in that owl and all nocturnal birds. So for parrots and most of the birds, it will be flat like this. And in some birds, it will be globular, just like a sphere, just like our human eyes. It will be globular. So most of the birds, especially parrots, it will be flat. So the front area will be like a flat surface. So the important factors or the things that you need to note is first is the cornea, which is the outermost covering, the outermost layer of the eye. Second is the lens. It is the part which focuses the object, which helps to see or focus where you are looking into. The third is the retina, where the image is formed. So if you look at a chair or you look at a pen, so the image is being formed in this retina and is interpreted by the optic nerves, and the impulse or the stimuli is given to the brain to assess what it is, if it is actually a pen, if it is something else. So that interpretation is done in the brain. So some more things that you need to know is this anterior chamber. So this is a chamber which consists of fluid called aqueous humor. And the second chamber, or the chamber that is separated by the lens, is the vitreous chamber. So usually in humans, it is occupied by vitreous humor, but in birds, it is also occupied by aqueous humor. So what happens is that it will be globular structure due to the presence of this fluid only. So it is turgid. It has got this shape because of this solutions only. So what happens is that it is continuously being renewed or continuously being circulated inside the eye. From this vitreous, it will move to this anterior chamber, and from this there is this area. It's called the iridocorneal angle. So through that, the blood it is supplied to the blood. So when this area, this iridocorneal angle is blocked, this circulation get distorted, and there is a chance for bulging of this eye. That I'll come to later. So just note the areas. The front part is the cornea, and below that area you can see the anterior chamber. Then you can see the lens. You can see the retina, the last portion, that pink colored portion. And this pectin oculi is actually for the nutrition, which helps in the nutrition of the eye. Then this brown color thing is called the iris. So in this image, you can see different color of birds, right? Like yellow, you can see orange, you can see brown, you can see white, you can see a brownish color. You can see red. It is the coloration of the iris. This portion, this brown colored portion is iris. So the area between these two irises is called the pupil. So you can see if you look at a macaw, you can see that it is constricting its pupil. When it gets angry, when it is so suspicious, it will get shrunken. So that area is called pupil. So just know the names of these, just to know what is the next slide. So I made it very simple so that normal people can understand. So by looking at the color of the iris, we can say, for some of the birds, we can say that if this bird is of this age or this bird is of this sex. It is indicative of age and sex in certain birds. For let us take an example of Amazon parrots. So in that, in most of the juveniles or most of the young birds, it will be brown in color. For the young ones, the iris will be brown in color. So as it ages, so as it becomes sexually mature, it can be said, its color changes. The color of the iris changes. In Amazon parrots, changes from brown when it as the bird ages, it will become reddish to orange in color. So in African grey parrot, it will be brown. By as it gets older, as it is in the semi-growing stage, let's say in the 6 to 7 months of age, it will be gray in color. So if it is in the 15 months of age or above 15 months of age or 1.5 years, more than 1.5 years, it will become white in color. Actually, it is white to yellow coloration. So in macaws, it will be brown in color when they are young, and it will change to gray in 1 year, in the first year, and in the 1 to 3 years, it will be changed to yellow coloration. So in young cockatoos, it will be brown in coloration, but if it is a female one, its coloration will become red brown, and if it is a male, it will become dark or black in color. So this you can see. These are the juvenile gray parrots. You can see the eyes dark brown in color, dark colored. You cannot distinguish the cornea or anything. Everything is black in color due to the presence of this iris. So when it becomes adult, when it is not an adult, it becomes 15 months or more than 1.5 years. Its color of the iris changes to yellow or whitish yellow color. You can see. Next one is the coloration of a hen, the female Gala cockatoo. So its coloration from brown, it has changed to reddish brown. So 1 minute. So in order to identify whether your bird has got some kind of diseases and all, or if it has got any eye affections, it's better to watch from a distance. As you all know, because birds are always master of disguise, they do not show their symptoms until they are severely infected or severely weak. So they will act normal, especially in case of eye and all, in grave disease and all, they try to mask their diseases to the end actually. So if you observe them, they do not move. They try to keep it. If they are in a perch, they try to be in the perch, and they keep their head inside their wings. They will turn its head and keep their head inside the wings. And so if the eye is affected, it will be difficult for them to find food and water. So you can observe when you try to give food, especially in the morning, usually the birds wait for the food to be placed. So, but this disease, especially the birds which are infected with the eye, they will be startled because they will be the last one to eat the food. They will slowly, they don't actually fly, they just use their net to move on, and they walk. They usually by walk they come. They don't usually fly if they have any problem with the eyesight. So if it is unilaterally blind, that is, if only one eye is affected, one eye is blind, you can see some birds, especially it is common in African lovebirds. You can see my face. Can you see my face?
Yeah, yes, yes.
Okay, so it will be like means the normal eye when if it has got a blindness in one eye, normal eye will be placed upward, so the head will be tilted. So
Okay.
so as to see all the animals or what is happening around, the normal eye will be placed upside. So that is tilting of the head will be there, and the abnormal eye, which the eye which has got blindness, will be placed downward.
Okay. Yeah, in ALB is also there actually. Few birds.
Yes,
react like
it's
that.
very
Yeah.
it's very common in
Yeah.
in African lovebirds.
Yeah.
So these are just images to show which eye is affected. You can see in this one, you can see the orange peach face. This one, can you see? Hello?
Yeah. Yes. Yes. Yeah. We are able to see. Yeah.
So this, in this one, first one, in this Lutino orange face, you can see the behind one is normal. You can see the eye that is very shiny.
Yeah.
You can see the periorbital area. That is the area covering the means around the eyes. That is called the periorbital area. And the one which is in the front, you can see it is dull, and actually there is a depression. The eye is not proper, and you can see the
The head is tilted a little bit.
this periorbital area is, you can see, but it is due to the rubbing and discharge also, ocular discharge, high ocular discharge. So this is the photo of a same bird. So you can see the left eye. See, it is as if it is very normal. So when you look at the right eye, that is infected. That is in the right side, you can see. So it has got infection. So it is necessary to observe both the eyes. Only one eye may be infected. So it's necessary for you to observe both eyes. So even the look has changed from this image. It is very happy. Means you can see some. It is actually positive energies that are in this picture. But look, it's the same bird, but it's from the different perspective. So normal eye will be symmetrical. So if you look at from the front means from the beak part, you can see it will be normal. It will be symmetrical. You will not see any bulging. It will be symmetrical, and the globes will be centered in the socket, which will be placed in the socket. So it will be able to move the globes equally. It will be in recognition with the other one. It will move. So, and as the photo suggests, it will be very clear. You can see from the image itself. And the conjunctiva. Conjunctiva, it's very difficult to identify in birds because conjunctiva is the part, the pinkish color. If you move this eyelid downwards, you can see that pink colored membrane, mucous membrane. It's called conjunctiva. So sometimes this, can you see the eyelashes? There is something down to the eyelashes. Sometimes for some birds, especially in macaws and all, it will be like just beads being placed in series. It will appear as beads placed in series. Sometimes it may be misdiagnosed as mites. So I have seen people, sir, I have seen a group of mites being affected in Macau. So they try to pull it and cause damage. So please understand that they are normal. They are actually some kind of glands, which is necessary for the tear production. So we'll come to the disorders straightforward, otherwise this will be very boring. So we'll start with different areas. So there are the disorders of lids and periorbital area mainly. Eyelids. So for birds, as I said, lower eyelid is very mobile and upper one is not so mobile. The organisms or the infections that is causing the eyelids are, first one is the pox virus. Most of them, especially the African hobbyists, are very cautious about this disease because most of them, maybe all of them, might have encountered this infection. Second one is the vitamin A deficiency. So actually vitamin A deficiency cannot be distinguished because in most, maybe in 92% of the cases, there is deficiency of vitamin A in ocular diseases. Third one is the chlamydia. Fourth one is the pneumococcus. Fifth one is the papilloma virus, and sixth one is the periorbital alopecia. I will some, especially pox is described somewhere else. So I will say what pox will cause in the slide. So it will cause pock lesions, especially in the periorbital area. You can see yellow to brownish coloration of pox lesions on the skin. In vitamin A deficiency, especially, the eye will be edematous, and you can see pus, like caseous symptoms can be seen. So in chlamydia infection, it is called one eye cold. Usually one eye will be affected, and especially the eyelids become swollen. And never you might be knowing about the scaly mite, right? It is the image you can see. A normal body is being infected by scale, where you can see the honeycomb pattern, some dots, that honeycomb pattern you can see on the face. It can affect, if it is severe, if it is a severe infection, it can affect the eye also, this eyelid margin also. Then next is the papilloma. It is, I will show the image in the coming slides. It is a viral lesion, just like wart. It may be confused with pox virus also. It will be a wart-like growth which can be seen over the eyelids. So this is also another type of tumor which is found in Cockatoo. It's called Hemangioma because it's the blood vessels are there. It is the cancer of blood vessel. The periorbital alopecia, that is alopecia around the eyes. It may be a symptom of a disease, or it can be due to overgrowing. If especially in fringes and all, if it is kept overcrowded, you can see this affection, because it will try to overgrow the corner, and it can be seen. And in African lovebirds, in breeding season, it can be seen. It is usually for some days only. After that, it will get normal.
Okay.
So this, of all the viral infections, this is what I found most notorious, because everyone, maybe in my experience, it is almost 99% of the hobbyists must have encountered pox virus. That's of sure, especially in African lovebirds, because African lovebirds and cockatiels are very prone to this pox virus. So actually, there are two types of lesions. Actually, based on its affection, it will be dry pox and it will be wet pox. Dry pox is affected on the skin, especially around the eyes in the periorbital area, especially in the beak region, in the leg region, where there is the feathers are scarce. So sometimes you can see under the feathers also, if it is too much. And the next type of infection is the wet pox or the diphtheritic pox, which you can see inside the mouth and inside the eyes also. So where it is moist, inside the mucous membrane it is seen. So usually it is seen as a self-limiting disease. That is, if it is affected, usually it will be cured within 2 to 3 weeks. But sometimes it may be complicated with this bacteria. Secondary bacterial infection may come and it complicates. And you can see in the left image of a pigeon. So it is complicated by bacteria. So you can see this scab that is brown, dark brown color scab. Actually, this scab itself is the secondary bacterial growth it is. Especially Pseudomonas, it will be affected. So when you talk about the transmission, you need a source. Actually, a bird infected with pox virus, it may be a carrier. You may not see too much lesions. It might be a small yellow colored spot on the above the eyelid. It may not be so noticeable, but you may feel it is something, but you will have that source. So when a vector, that is, it can be a mite, it can be a lice or anything, especially mosquito. Mostly it is transferred by mosquito. So you need a vector. It's a vector-borne disease. So that vector bites an infected bird and get to your healthy bird, it will affect it. So the method of transmission is usually a mosquito-borne disease. Secondly, if it is in close contact. So if an infected mosquito is bitten, usually you can see within 10 days or 7 to 10 days, you can see the pox lesions. So if you get a case of pox, so just check or keep them in observation, that because in 10 days you can see the lesions if it is affected. So this caseous material also is called the pus because in birds it is inspissated, it will be very hard. So it is very difficult to get rid of that pus. It will be cheese-like. That can be seen in the oral cavity and in the eyes also. So what I feel is that though it is a self-limiting disease, sometimes in contact birds, if you say some bird has been transported along with the pox bird, so it has not shown any symptoms yet, so you can treat antiviral drugs to that birds only. So it may provide some kind of prophylactic effect. And in my experience, it has helped in some cases. Maybe if it is a 5 days gap, means if it is infected more than 5 days, it will definitely can cause pox infection. Or if it is lower than 5 days, we can it is antiviral drugs effective, and it is mandatory to give immunity boosters, especially vitamin D, vitamin syrups and all. And there are other immunity products. Well, I'm not going to that, otherwise it will be you may say I'm going to brand that product. No, I'm not talking about any product. I will not show any product in this also.
One doubt actually. So few birds are there which is already pox cured and I'm having in my breeding aviary, and I'm buying one new bird that is contained the lesions, whatever you said. So I'm quarantining and then I'm just keeping that bird in my aviary. So
No.
will again the pox will again spread because it's already the pox cured, right? So
Yes, there is chance because of the presence of this presence of, as I said, presence of vectors. Next is the cage. You need to sterilize the cage, and please avoid if you are using any products. Please try to avoid using on the birds.
okay.
So, I'm talking about disinfectants. You can use some products are advised, but still try to avoid maximum because it causes some kind of irritation to birds. Then another thing is that so many of them ask about ointments and all. So you can use antibacterial ointments. Sometimes it is in the beginning stage that actually it start as a red coloration. Slightly it will change to yellow, and later it will change to dark brown color. So in that red coloration stage or that yellow starting stage, if you can apply antiviral drugs like acyclovir or something, it will definitely show improvement. Otherwise, what you can use is that our home remedy like medicine is that turmeric, raw turmeric, and sooth. And I don't know what you say. Hope you know what sooth is. Just like ash. Then salt and our coconut oil or some kind of oil to mix it. So what I do is it is recommended for our poultry. Okay, I use it on the skin. So it has shown some result to me.
Okay. My question is like already pox cured birds are there. So
No.
again, I'm just
Yes, of course. For about a month, it can act as carrier.
Oh, okay. So again, the pox cured bird also again it will affect pox.
Yes, there is a chance. So it's
Okay.
better to quarantine them for about a month. Then
Okay.
you can keep it in your aviary.
Oh, got it. Thanks.
So next is the eyelid abnormalities. For birds, there is 3 eyelids. One in the upper, one in the lower, and is the third eyelid, that is the nictitating membrane. So in birds, usually they blink only when some kind of menace or something it points to its eye. Otherwise, the third eyelid, you can see some kind of a semi-transparent or whitish third eyelid inside. That is usually helps in this moisture of its cornea. So these are the abnormal conditions of the eyelid. This is the cryptophthalmos. That is the formation of eyelid is not proper, so that you can see only the small part of the eye. So in this picture, you can see this cockatiel. So you can see the eyelid. So it has not been properly formed. So you can see the small opening. It's a development anomaly. Even surgical, if you go for any surgical intervention also, it is not so fruitful because that wound edges will again oppose and it causes this fusion again. So it is common in African lovebirds and the cockatiels. It's very common in cockatiels.
Okay.
Then Blepharophemus. It is the narrowing of papillary fissure. In this one you can see the third eyelid has almost covered half of its eye. Even in this area also, it is very difficult to surgically correct. Next one is symblepharon. You can see the entire eye is being covered by this eyelid. The last image you can see. So in this one, we can go for surgical correction because it has found to be effective. So this will be other to the globe. So there is a high chance of risk that it may affect the eye, especially the cornea and all, because it is in fusion with the cornea. Next is the scarring deformity. In this blue and gold mica, we can see above the eyelid because it was rubbing in its cage. Then neoplasia. So many types of papillomas, commercial carcinoma, melanomas. Mostly melanomas will be dark in color. Next thing is the conjunctiva. So in order to just add this one to show you what conjunctiva is, because in birds it's very difficult to identify the conjunctiva. So when you get to a human patient, usually they check your anemia, the amount of your blood in your body by looking at the eyes, right? So that area that the doctor look is called the conjunctiva. So for birds, it's very difficult to identify, very difficult. So in order to get the idea what conjunctiva is, this is the area that is called the conjunctiva in animals, and that will be same for birds also. So this is a condition in goat called chemosis, where the conjunctiva has become swollen and inflamed, and even it came out of the globe. It's called chemosis. So that can be seen, especially the African lovebirds infected with viral disease. You can see this type of protrusion, especially third eyelid or even the conjunctiva can be protruded. You can see red coloration of the eye. You may not see so much of swelling, but you can see eye discharge, more amount of eye discharge. That is called epiphora. So epiphora can be seen along with red coloration of eye. It is suggestive of viral infection. So in conjunctivitis, there will be thickening and hyperemia of the conjunctiva, and it will be associated with epiphora, that is increased amount of ocular discharge, especially in sinusitis, respiratory infection, and neoplasia. Sinusitis might be annoying because these are areas inside the bone where there is filled with air. There are spaces of air. So it may be affected, especially with fungal infection, it may be affected. And other etiology, causative agents are the bacterial infections, especially the Staphylococcus, Cornebacterium, Escherichia coli, Clostridium, and Pseudomonas. So these are the most common one, and nothing more I've observed till now. And very common is the Staphylococcus and the Pseudomonas. Most often when we go for corneal swab, it's very easy to do corneal swab. I'm talking to the vets who have joined. Get a sterile swab, moisten it, and use that cotton tip to swab the cornea, not the conjunctiva. It's better to go for the cornea because conjunctiva may possess some kind of dirt and all. So it's go for corneal swab, and you must use one swab for one eye. If it is right eye, you need to use one for right and one for left also, and go for normal consular sensitivity. That will describe what organism is, and based on the organism, you can give the medication. And next is the Mycoplasma, very common one, very common because most of them are not so aware of this Mycoplasma infection. Next is the Chlamydiosis, and another one is the Mycobacterium. I will come in detail, that's why I have not mentioned anything here. Next is the viral infection. So as I told you that pox virus is the most common one. So I have discussed it earlier. So these infections, even we discuss it so much, it is no use because there is no treatment actually for viral infections. The bird's body, bird's immune system has to fight against it. Otherwise, there are no medications actually. For you can use certain medications for herpes virus, still it is not so effective. That's why I'm not going much into it. So just understand there are viral infections like paramyxoviruses are there, herpes viruses are there, adenoviruses are there, pneumovirus, and cytomegalovirus. Cytomegalovirus is seen only in golden finches. So I mentioned it because so many of us, and including me, I used to keep different types of birds, especially finches, goldians, African lovebirds, cockatiels, conures, macaws, everything is in one aviary. So there are chances that it can get, other birds can also get infections from this different species. So paramyxovirus, there is no treatment. If it is infected, most of them will die. And next is the herpes virus. If it is found earlier, we can save the bird by giving antiviral drugs. But the problem is for all of this, the diagnosis part is very difficult. We might need for PCR test or ELISA. So that is very difficult for so many of us to get it identified. And now I have seen, especially I discussed with foreign breeders, good breeders. So they have told that they have isolated or their aviary has been infected with adenovirus, which shows severe eye infections and anorexia, diarrhea, and death. Death is what the ultimate thing is. So many of them, especially that has been imported to India, imported to Egypt, they are dying because of the adenovirus. So I will get more details in later on. So it is their works are being going on. The treatment is only going on, so I didn't get any update till now. Next is the fungal infection. So as it is common, aspergillus and candida, as it is always there, they can also affect the eye. And cryptococcus, it's also a fungal infection, but it usually affects only the immunocompromised one. Next one is the parasitic. Of the Oxyspirora mansoni, Ceratospira, and Thalassia, these are worms. It is most commonly seen in pheasants and galliforms, that is in poultry, and very few, especially large birds like macaws and grey parrots may get this eye worm. That you can see, the eye worms are actually moving. You can see them. Next is the protozoal infection, Cryptosporidus infection, plasmodial infection. These are not so common, but still it can be seen, especially in canaries and poultry. This plasmodial infection can be seen, causing eye inflammation. Next is this microsporodiosis. It can cause conjunctivitis. Then this foreign body. I mean, sometimes you can see even iron particles from the rusted iron particles inside the eyes, even this husk of thinna and all, Italian millet and all, it can be seen inside the eyes. So this can act as foreign body and cause irritation to eye. Next one is allergies. Especially I've seen some of you using DDT and some kind of fly repellents, maybe powdered form, that is causing allergies. And some kind of plants, especially that passiflora. And I'm talking about I've seen a case, especially in grey parrot. I've seen that passiflora, passion fruit is there. No, passion fruit plant, when it starts to flower, it can cause allergy. I've seen in one area. So these are the images. So in this grey parrot, you can see one eye worm here. So it has severe itching, so that's why it has bruised its periorbital area. This is the eye worm in bustards. You can see as big ones. This is due to E. coli infection. How we found is that it died. Most of them die as hatchlings. They will die within 2 or 3 days. Most probably it was due to E. coli, so we cultured it and it was found E. coli. And this is a type of papilloma. It's not. It looks like pox, but it is a tumor. But it's benign tumor. It does not cause any life-threatening condition. This is some kind of a typical viral infection. You can see this one. Please keep in mind this is a typical viral infection where you can see the third eyelid prolapse or the conjunctiva being red in color, and you can see when you look at the cornea, you can see some light coloration, bluish coloration. It's not clear. That is due to secondary bacterial keratitis. So primary cause is the viral infection. Second is due to the keratitis caused by the bacterial infection. So when we culture it, we can get bacteria. So if you
will form white color layer or something. Any tissues will create or whatever.
No, tissues are not created. It is an inflammatory condition.
Okay.
White coloration is actually the white color cornea.
Okay. Color will change, you're saying, or yeah?
If it is in the early stage, if you correct it, it will change. Otherwise, it will get whitened. It will become white. We cannot correct that. If it is completely white, we cannot correct that.
Okay.
And this one is typically vitamin A deficiency with secondary bacterial infection. So we gave vitamin supplementation, it got cured. So this white thing, cheese-like substance, that can be taken out. That is actually pus of birds. It will be cheese-like, that can be taken out. If it is not in the proper stage, there are some stages where it should be taken. If it is taken early, it may bleed. Next one is the bacterial infections. So you can see in bacterial infection, you can see this white caseation and too much of swelling of eye in bacterial infection. So in order to identify which bacteria it is, which antibiotic it is sensitive to, we need to do a corneal swab. So at first, what we do is we will try our empirical therapy. If it doesn't work, it's always better to go for cultural sensitivity and go for your therapy. So you can see this white coloration. This is the pus, insipid pus. It can be taken out and medication can be applied. This is also a pseudomonas infection. Medication can be applied. This is mycoplasmosis, as I told you earlier. So it is very common in our poultry. So if you are keeping some exotic poultry and fancy chicken or partridges, quails and all, it's better to avoid them from your main aviary. Because I've seen, especially in Tamil Nadu, I've seen mixed aviaries where you keep parrots in the suspended aviary, and you keep that bob quail and mutton quail and roll partridges and all in the downstairs. Means to clean the mess that has been created, you keep them roam. I've seen, especially in Tamil Nadu. Yes. I think it's better to avoid. If it is for not for breeding or it's for a hobby purpose, okay, it's fine. But if you're truly cautious about this diseases and all, it's better to avoid them. So it is called bulgy eye. So this is the main culprit when you see after transportation. Many of them with complaints that it was normal only. I've seen them personally, and after transportation, it has got eye infection. It is what most probably they're saying, eye infection, and after some time it may die. So it is because that this peculiar disease is very sensitive to stress, especially after transportation or when it is moved from one place to another. The organism get activated, it get flared up, and it will cause infection. Especially what we can see is the bulgy eye. You can see both eyes bulge. You can see even the head or the lower area bulge, where the face bulge. The organism is Microplasma gallisepticum. You can see nasal discharge, ocular discharge, even cough and sneezing can be heard. So even you treat the bird, or even it may act normal, it will act as a carrier. It may have eye infection. Sometimes you may use some eye drops. It may resolve for some time, but it will act as a carrier. So utensils, the items that you keep inside, like the water, feeder, purse and all, can get infected. And it is a vertical transmitted disease, that is from parents to young ones. So when it lays egg, it can be transmitted through the young ones, through the egg also. Next one is the chlamydiosis. So chlamydiosis is actually it is a zoonotic disease that we can also get, but I don't think that there was any cases reported. There was one case somewhere in the Northeast, but I'm not sure about it. So the culprit is Chlamydiophila psittaci. It is called one eye cold. Usually one eye will be affected. In the initial stage, you can see one eye being closed with some kind of discharge. Then the bird will be anorectic for some time. Later on, it will start to eat. So we might think that, it has resolved, the problem has resolved on its own. But it is actually the starting of the disease, it is getting bad. So if you check its keel bone, you can see the prominent keel bone, which will be blade-like. But it will be having normal appetite. Then you can see this is the picture I've taken from infected bird that is dead. You can see this greenish discharge. This color discharge will be the keel bone will be prominent. Sometimes you can see that one eye will be affected. Usually one eye will be affected. So for that, treatment requires, diagnosis itself require PCR. Otherwise, it's very difficult. Or these post-mortem lesions can be helpful. but treatment is very hectic because it takes more over 42 days for treatments. It sometimes it might not be effective. But I was happy because I could save aviary consisting of 300 birds. I treated them, and most of them, I think I could save almost 278 birds. Rest of them have succumbed to death. So these are the the difficult part is that if you got so many birds to disinfect the cage, it is very important, because when you get purchase or when you get other healthy birds, if you are putting in the same cage, there is no use. So this disinfectants can be effective. So what I did is that I told them to use sodium hypochlorite in this ratio and dip that cage inside. It was China cage only. He dipped it inside that one and gave that flame was there, no flame gun. But the problem with flame gun is that if you flame it, sometimes that paint may go off. So he had to repaint it again. So this is the organism that you can. It's called LCL bodies. So it is very difficult to get this picture. I got it from the net. So to identify by doing histology, that is postmortem sampling, it's very difficult. Next one is the Mycobacterium. So Mycobacterium usually affects the larger birds. I haven't seen any cases in African lovebirds or smaller birds, but I have come across in macaws, grey parrot, and lorikeets. Especially some rare lorikeets like Stella lorikeet and all, I've seen this Mycobacterium infection. So usually we will not be able to identify. Even if it is eye disease, we will always go for this routine therapy like this bacterial infection, viral infection, but rarely we find it is a mycobacterial infection until it is dead. If it dies, we will do postmortem and we will understand that it was Mycobacterium. So if it is a live animal, it is very difficult to diagnose from live animal. So the partner can be saved if it is if postmortem is done. So two species are there: Mycobacterium avium, Mycobacterium genievens. So it is for humans it is a respiratory disease, but for birds it is an enteric disease causing diarrhea, anorexia, and all. So it is a slowly progressive disease. That is, it will take so many time. So if it is affected now, it may take more than 6 months, 7 months, or even 1 or 2 years to get infected completely. So it will be very lightweight. You can see that prominent keel bone. And if postmortem was done, or even endoscopy will be effective to see this granulomatous lesion. These white lesions you can see inside the intestine and all. That is called the granulomatous lesion. It can be seen in intestine, liver, and lungs and all. And sometimes I've seen cases in grey parrots where there is crusty lesions on the skin. So when it died, I did postmortem and found that it was okay. It was Mycobacterium only. But otherwise, it is very difficult to distinguish between skin infection and Mycobacterium, and even eye infection infected with Mycobacterium. And one more thing is that even if you find if it is alive and if I found that it is Mycobacterium, it is very difficult to treat also, because Mycobacterium, as I said, it's a slow progressing disease. It takes almost 16 hours for its multiplication. 16 hours for multiplication. So we use combination of 3 drugs that will be based on the current therapy. Usually 3 drugs are used. Even now, for humans, it has been changed. Some of the drugs has been changed. So it takes almost 9 months treatment. Due to the slow growing phase, it requires 9-month treatment. So it is not so rewarding treating Mycobacterium. Next one is the fungal infection. You might be very well aware of this fungal infection, especially Candida. You can see, especially in hand feeding or young chicks, you can see white deposits inside the mouth. Most probably it will be Candida, especially Candida albicans. It will be white colored. It is called Sorklop, Moniniasis, thrush, and many other names. So it is because of the alkaline, especially the hand-feeding formula. Hand-feeding 6 have come across. Hand-feeding formulas usually will be alkaline in nature, and some might have high amount of glucose. So this high glucose and alkaline condition favors the growth of Candida. So what we do is that and it affects the esophagus, and this whitish diphtheria membrane means a false membrane will be formed. So what we do is make the condition acidic. For that, we use apple cider vinegar at 10 ml per liter of water. So even to control other fungal growth, you can use apple cider vinegar at 10 ml, 10 to 15. You can go for washing and all 10 to 15 ml per liter of water. That is, it comes around 1 ml in 100 ml water. So in case of severe infections, especially eye infections, you can, if you see, you can use antifungal eye drops and oral antibiotics. Systematic antifungals are necessary. Next one is the aspergillosis. Aspergillosis is not so common in our African lovebirds, but in overcrowded in colony setup, it can be seen. So it is mostly seen in our falcons and all, and in chicken, in small chick. It is called brooder pneumonia. So causative agents are the Aspergillus fumigatus, Aspergillus flavus, and Aspergillus niger. So it can cause eye infection, especially that is associated with the sinusitis caused by this Aspergillus. So it will cause a respiratory infection. You can see this oral cavity is being affected. Its lungs is being affected. This is the air sac. Air sacculitis will be caused by this aspergillosis. So for culture and sensitivities, it's very difficult to identify because it takes 15 days for culture. So by the time it may die, because if it is sent for culture, it takes the 15 days to get the result. And for candidiasis, it is easy. Even this organism, you can see this blue color organism. It is budding yeast. It's a yeast type of yeast. So by using lactophenol cotton blue or even field stain, you can find whether it is Candida and all. But aspergillus is very difficult. It is a slow growing organism. So if you wait for result, it is very, very difficult to get a good result. So you can give it for culture and start the treatment after consulting a vet. And this is found to be effective with the nebulization. You can use this one if you found with fungal infection, respiratory fungal infection. So 500 mg terbinafine, 500 mg capsule, or 250 is commonly available. Capsule, 2 capsules plus 1 ml acetylcysteine and 500 ml distilled water can be used in nebulizer and can be nebulized. You can use a plastic chamber or direct nebulization. For small birds, it's better to use this plastic chamber. Next is the Microsporodiosis. It's also a fungal infection, especially in that is already infected with viral or other infections, because it affects only immunocompromised birds. So it is an obligate intracellular parasite that is eukaryotic and it is spore forming. You can see this organism here. These are not commonly affected, but I just want to know that these are there. Next one is affection of cornea, the outer layer. So most common is xerophthalmia. It is caused due to the vitamin A deficiency, and it causes lack of tear production, and it will become keratoconjunctivitis sicca, KCS it is called. So it will the cornea becomes dry. That is why it will become white in color. And if you don't supplement proper lubricants, it is very difficult to get it back. This is keratitis. You can see this white coloration. And in this indented neck, you can see one white spot area. So it has got cholesterol deposit along with pterygium. Pterygium means the conjunctiva will start to grow over the cornea. The conjunctiva that is placed laterally or around the eyes will start to migrate, start to grow over the cornea. That is called pterygium. So you can see cholesterol deposits. So this bird was fed only on this seed mix, not seed mix, but sunflower. So it is very high in fat. So avoid high fat diet for birds. You can give, especially in breeding season and for occasional as a treat, you can give, but only high fat diet is causing problem. So it can be seen common cholesterol deposits in the eye is common in Amazon parrots. So infectious keratitis is seen in bacteria, fungi, and microsporodiosis. So the only virus that causes keratitis, that is infection of cornea, is found to be our pox virus and PMV. But so most probably, if it is the infection of the cornea, it can be attributed to bacterial fungal, which can be treated. So next one is the non-infectious. If some kind of foreign body, if, as I said earlier, some kind of husk of this Italian millets or rusted iron particles or something can cause trauma. It may cause corneal opacity or corneal ulcer. Next one is toxoplasmosis. This is also a new infection. Maybe you might have heard it only the first time, because it is not usually common in our pet parrots, but it is seen in raptors. It is seen in chickens. So it is actually a zoonotic disease. That means it can affect human beings, especially pregnant ladies can be affected. That's why it is advised that cats should not be handled by pregnant ladies, especially during their in the gestation period. It is advised not to mingle with cats. So it is because of this infection only, Toxoplasma gondii. So, but luckily, this parrot species is not found to be zoonotic, because it has been found in budgerigas, Alexander parrot, Cockatoos, and African lovebirds, but they have not found to be causing infection to humans. So what they cause is they cause retinal scarring. You can see this is the image from this ophthalmoscope. So you can see this retina is being scarred or damaged by this toxoplasma. So it can affect the nervous system also. It can cause blindness. It can cause tremors, seizures, and torticollis. The problem is it is very resistant. Even in cats, sometimes you can see red-colored eyes and all. Sometimes, and it can get self-cured. Actually, it acts as a carrier. So what happens is that if the defecates or the feces may taken up or get contaminated in the water or get taken up by the birds. So the bird will be affected. So if this infected bird is eaten or preyed by other cat or non-infected cat or other falcon or eagle, so it will become affected. So it will be like a continuous cycle. So from birds to cats or even from rats, it will affect cat. Then from cat to birds. So it will be a cycle. So this organism is found to be resistant to acid, detergents, and alkali. And this steam, ammonia, and dry heat, especially it is not heat tolerant, intolerant. So heat can be used. Flame gun can be used to sterilize the area. Treatment is also very difficult. Injections are necessary. Oral medication won't be effective. Another one is the Cryptosporidus. It is also an enteric protozoa, that is, it affects the intestine. So you can see nasal discharge, diarrhea, and abdominal pain and vomiting. So this can be identified by modified acid fast staining. As the name suggests, it is Cryptosporidus. It is being what? It tries to hide in certain areas. That's why it is very difficult to find. Crypto means to hide. So it is a spore. It causes sporulated oocyst in the fecal sample. So fecal flotation can be done and staining can be done to identify the organism. Next is the inflammation of the uvea. As I said, uvea is the part that contains that iris, ciliary body, and all. That is the area, limbus, especially in the limbus area. So this case is called hyphema, because this anterior chamber is filled with blood, because it was met with one accident. It fled to the wall and got hit on the wall. So its eye is filled with blood. So after about 7 days, it became normal. Sometimes it is very difficult, because if trauma has occurred, it's very difficult to correct the bird's vision. So in case of Rio virus and in case of lens rupture and toxoplasma, this can happen. Sometimes this eyesight, it may get infected with pus. Then that condition is called hypopyon, infected with pus, and anterior synechia, posterior synechia. So many terms are there. So that can be only diagnosed by a vet which has got practice in ophthalmology. You should have that ophthalmoscope and many other things. So it's difficult to identify what is the problem. So I request, if you cannot handle, if you are not sure about it, don't treat it by yourself. Get it to a vet. Next one is the cataract. So that is nowadays it is becoming very common, especially in young ones, that is being hand fed. So this is a cataract. You can see the cataract because lens is the opacity of the lens. So in canaries, it is a genetic defect, but in juveniles, what I find is that some give your bakery items and all sweet items that can cause diabetes in small one, especially in macaws. I've seen that in eclatus parrot, causing this cataract, juvenile cataract. It is because of this diabetes. And I have seen in certain tamed African lovebirds, which has been they use what homemade products like ambratham and all, which is so high in glucose. I've seen in cases tamed birds. Next one is the exophthalmos because the eye globe will come out of it. It will start to protrude out of the globe due to the high intraocular pressure. It is called glaucoma. When there is normal pressure in the eye, if it is more than that, it will cause problem and it may come out of the eye. So before getting the management, most of the problems that means if it is presented earlier, we could have what treated it. So this image of this cockatiel, we can see some kind of white liquid area, right? You can see. So that is actually it's called a melting ulcer. It has been caused by the indiscriminate use of corticosteroids. You might have seen Ciplox D, Tobra DM, and then something like that. Dexamethasone, betamethasone. You can see so many items. That is called steroids or corticosteroids. So due to the use of this steroids, it has caused this problem. So if the bird is having some kind of ulcer, that is some kind of breakage in the cornea, it's better not to use steroids. That's why it is important for a vet to be examine your bird's eye. Then only let him prescribe. If there is no ulceration, you can go for the steroids. But if there is steroid, it will delay the healing. It will cause this. Next one is also. So what he did was it is a minor. So it was okay only. He used against steroids and he used to this cotton tipped buds is there no. So he is used it daily very roughly. That's why it cost like this. And this one was Mycobacterium infection, but he thought it was a normal eye infection. So he used to give antibiotics for 7 days. It will get cured for some time. After 2 weeks, it will again recur. So it's what I said is that it's easy. I can give you many names, or even if you Google, you will get many names, many antibiotics, antifungals, and all. But it's better. It's always better to that it is consulted by a vet because he knows what organism it is. Even I've told about Mycoplasma. It is a bacteria which does not have cell wall. So if you are using any drug which is acting on cell wall, it will not be effective. So only doctor knows what is necessary for this organism, what is necessary for this kind of damage to the eye, if it is affected in the retina, if it is affected in the cornea. So he might be knowing well, maybe, of course, 50 times or 50% is better than a normal breeder. But there is a fact that every day a hobbyist sees a bird, but you may not get an avian vet. It's fine, but you can also go to a normal vet. He might be knowing about ophthalmology definitely. So this is the end.
Many people are using Festive D and Ciplox D.
Yes,
for
yes.
the normal eye.
Yes, now also I got a call. He used Ciplox D. Now it's not healing. That's what he said.
Okay. Okay.
So I don't want it to stretch it so hard. Otherwise, all will get bored, and that's why I finished it so fast. I have
Yeah, it's more technical part, I think. Yeah.
Yes.
It's good to it. Yeah, guys, like any doubts, basic things I think you can ask. Many of you met who are breeding the African lovebirds, like definitely met the eye issues. All I know, even small questions also can ask, no problem. Any precautionaries or to like no, my doubt is like what are the precautionary things we have to do for avoid this type of eye infections? So do you have
Eye
suggestions?
Suggestions, especially during this hot climate, that is our summer season. That is now it's in south. So I am now in
Yeah.
Mizoram, so it's cold here, no problem. But it is the beginning of the summer season. There is chance for eye infection. What I have attributed is the presence of bad water, because it is stagnant, right? Water gets locked in one specific area, so it may get infected. So poor water is a source of most of the disease, what I found. And these birds get very exhausted due to this high temperature also. So they are very prone during this summer season. So give extra care, especially in the time of water and food. We try to avoid high fat diet, which is causing too much of fat. You can give in the June is coming, breeding season is coming. So you can use a high fat diet in when it starts to rain. So in the hot climate, try to avoid high fat diet. You can use good quality water sources. And always, the problem is I too have African lovebirds. I'm not a breeder actually, because I don't know the genetics. I'm still in the learning process. It's very difficult for me to get. So I've got many birds. That's why. So I don't concentrate on Africans alone, because that's what a vet should be, right? So what I feel is that when you procure a bird, be very cautious that it is from a good source. So if I want to procure a group of birds, what I do is that I get acquainted with that breeder. I used to chat with him. I will used to get to know him, how its practices are. Only if I am confident enough, I will purchase that bird. So always especially I'm talking about African lovebirds, the source is very important. Even in my case, I have started with birds that is purchased from the pet shops only. So pet shop is actually it's a collection of many diseases, because there are so many birds that is coming from different areas. You don't know the origin. You don't know why it has been sold. You don't know why it has been in that case, how long it has been in that case. So it's better to avoid from a pet shop. It's always better to get from a breeder. So source is very important. And quarantine, everyone usually do is 1 week, 2 week. I advise it is to be 45 days, because some diseases may manifest only after several months and all. As I said, if it is mycoplasma, if it is some kind of slow progressing disease like Microplasma, Mycobacterium and all. So it is very difficult for you to get this disease if you are quarantined it fully for a few days. So 45 days of quarantine is necessary. So keep that away from your main aviary. What I see, people used to quarantine. What they do is inside that big aviary, they used to keep 1 or 2 China cages for quarantine. That's what I feel. I've seen many people doing that. So it's not like the quarantine area should be separate. No item should be transferred from quarantine cage to your main aviary. Everything, even your chappals, even if you're using gloves or anything, wash your hands. At last, you should go to your quarantine shed.
Okay. The next question is you told the vitamin A deficiency, right? So most of the ALB's breeders actually they used to feed the beetroot and carrot, and those are like vitamin A enriched one. And so in top of that, whether we need to give any supplements for that or it's not required.
If you're confident enough if you're not confident enough of your food or diet, I think it's better to give supplements once or twice in a week, because vitamin A is a fat soluble vitamin, because it gets distorted very, very easily. So that good quality can be means it's very difficult to replicate that good quality. Even if we use carrot, beetroot of good quality, even during the process of if you are steaming it, it can get means the quality may get reduced. So you can give, especially vitamin means fat soluble vitamins, you should give only once or twice in a week, because it gets absorbed in the fat, it is not eliminated. So if you're using water soluble vitamins like vitamin B complexes, vitamin B, B1, B2, riboflavin, thiamine, folic acid, biotin, such medicines vitamins are there, like vitamin C, they are water soluble, that you can use daily also. But it's advised you give it for some times and stop it, and once in a while you can give, because it will eliminate it through its urine. no problem.
Okay. Okay. Yeah.
And for breeding purpose also, one more thing, if you're giving calcium, I've seen breeders giving calcium when it starts to lay egg. No, it's not like that. You have to give calcium supplement at least 2 weeks prior to your expected mating. If you have seen mating, definitely you have to start giving calcium. If it is
So-
a calcium.
Personally, like, no, I met the egg shell is too strong actually. So the chicks are like, particularly for ALBs, it's trying to break the egg, but the dead shell is happening actually. So end of like 21 days
So
after
is it, so is it like overfeeding? It can
Yeah,
also
actually. Okay.
maybe means some are very cautious that they give overfeed. I've seen also. They also prefer good quality products. They used to overfeed throughout the year. They used to give
Okay.
calcium. I have seen.
So what is your suggestion actually? So we can mix that supplement or calcium, whatever it may be,
That's
for
what I'm saying. At
water
least
or a soft food for
first,
ALBs.
that's what I'm saying. If you are planning, if you are preparing for the birds, preparing the birds for breeding, if you have seen mating, you can give from the moment you start seeing mating, or even if you plan, okay, it may breed this time. So their nest preparation, their bonding, you may predict that it may lay eggs within this time. So
Yes.
prior to that, 2 weeks prior to that, you start giving this.
Okay.
The
Okay.
supplementation
All-
maximum of 2 weeks. Give it maximum of 2 weeks, then give only that whatever calcium block or something. If it is deficient, it will bite that.
Okay.
Don't give it in water. Give it only during prior to its breeding. Because prior to its breeding, it will absorb this calcium and it will deposit in the medullary bones, that's like in the long bones, causing development of medullary bones. So during this egg process, what birds do use that they use the medullary calcium, not the calcium that is being given directly. If you give calcium today, it will not be absorbed and deposited in the egg today or tomorrow. So it takes 2 weeks of preparation for the formation of eggs. So it's better to give earlier, calcium supplements earlier.
Okay. So earlier you told like regarding that quarantine. So anything we need to take care during the quarantine, or just keeping the bird in the separate cage is enough, or any like applying disinfections or anything we have to do for the birds?
You can if the bird is not dewormed, if you're not sure about necessary, you can deworm the birds. Next is you can use avian insect liquidator or any kind of insect repellents. Then if there is infection of pox and all, you may use some kind of disinfectants, but I don't advise.
Okay.
But it's always better to give good nutritious food, especially protein-rich food. Actually, this quarantine time is the time for your birds to adjust your diet, because it will be from different area. If it is what I feel is, if it is a pellet feeding, it is having a habit of eating pellet. You may not be using pellet raw, so you will get time to convert that from pellet to non-pellet.
Adoption. Yeah. For our food diet, it should be about adopted.
Yes.
Any special things like you'd like to discuss about this, avoiding this eye issues, particularly for ALBs or new? We are like we are just whatever we saw in net, and then we are following them. As a vet, like veterinary doctor, like you can suggest basic things like.
Definitely, basic thing is that proper food, proper vitamin supplementation, and as I said, if you encounter with eye infection, it's better to go for that concern sensitivity, which is available. Then go for this antibiotic according to the sensitivity. But the problem is that if you don't go for sensitivity, so you will go for that empirical therapy that is there available in your market. It can be cycloxidine, it can be topiradium or something that you get. It is maybe it may not be sufficient. It will be resistant also, because you have been using for long. It is maybe from the start of this Indian agriculture industry, it might have been using. So it's better to go for this cultural sensitivity. Better don't go for empirical therapy. Then if you find infected birds, definitely you have to separate the birds. Don't keep it with them. Definitely separate and treat them at last. After all your works, treat them at last. And in birds, this if you're putting antibiotic, it's not like one time, two time. At least it should be 4 times if you're putting antibiotics, especially liquids. If you're putting, you need to do it for 4 times at least, minimum. Sometimes it may go to 6 times also. So if it is an ointment, okay, you can reduce the number of times that you're doing this medication, because it will stay for longer.
So, for example, like my bird is like pox affected, and it is cured also. And so, at what time I have to put the bird for the next breeding? So, how many months or days like gap is required for breeding?
That's what I said. 1 to 1. If it is completely cured, means that pox lesions, it is get rid of the pox lesions. From that day onwards, at least 1 to 1.5 months, it is necessary to keep it there itself. Otherwise, there is a chance for shedding. Still, the organism may be present.
Okay. So it will carry forward to chicks also.
It does not usually affect the chicks when it is completely free.
Okay. Because I used to have one pair, but the one, I think it is a box cured bird. Even if you see the leg, actually, the nail won't be there. Due to the box, actually, it got cut down. And then almost 2-3 months I quarantined, and then I kept breeding. And whenever the chicks born, after 3 to 4 months, after 2 months from the nest out, again the eye issues are coming. From the
pox. Is it from the pox?
It is started closing the eyes. Yeah, no lesions, nothing actually. It is very active, but after 2 months, exactly, almost 3 clutches completed. Chicks are very active, but after 2 months, averages after 2 months, it starts closing the eyes. Slowly, it starts closing the eyes, and then it is very dull, and then finally, like it's expired.
So first of all, make sure that it is a pox itself. Next thing is that if you're suspecting pox, please check for mite and all. Okay. If you're using wooden cages or wooden perches, definitely there will be chance of mites that cannot be eliminated. Okay.
So completely should be disinfected, right? So maybe.
Yes. Some disinfectants are not effective for mites, so please be cautious about mite disinfectants and sprays and all.
Okay. Thank you. Okay. Guys, like if you have any questions, you can ask us.
Hello, doctor. This is Arun Tampi.
Tell me.
So I have a doubt regarding the immunization regarding that part. So pigeons and all, some breeders are using some vaccines, right, for the pox, for the other neck twisting and all. So is there any such medicines that are available for the African lovebirds or cetaceans like that?
Yeah, vaccination.
So I think PMV vaccine is available in India. I don't think any vaccines are available. Only some are being imported, especially in pigeons. They bring it from outside, especially from the Middle East countries. They bring it from outside. So there is no supply right now. There is no supply of even pigeon vaccine or any other vaccines right now. But that can be used, because in pigeons, even our chicken vaccine is there, right? So chicken vaccine can be used. Certain strains of chicken vaccine are being used for PMV and salmonella, not salmonella, PMV. For Papilloma, for paramyxovirus, we are using chicken strains. For the birds, it is lendogenic strains we are using. That is the least one. It's the least pathogenic strain. It is lendogenic strain that can be used. Right now, it is not available.
Okay, doctor. Thank you.
We use wing prick method, not that usual injections and all. It is wing prick method. For poultry, it is available, but for pet birds, it is not available.
Good evening, doctor.
Good evening.
Doctor, I am Sultan from Trivandrum, Kerala. As you said, the apple cider vinegar is good for preventing this fungal infection. It can be used for adding water to drink. It is possible.
Yes, it can be used in water. In drinking water, it can be used. That's what I said. The dosage is 10 to 15. Actually, 10 is ideal. 10 ml per liter of water.
Per liter water to drink. It's safe. It is safe for
It
drink.
is safe. It is safe. Yes.
Okay.
Because
Thank you, doctor.
I'm talking from the theoretical part itself, because it is from textbooks I'm talking about, not from experience. It's from textbooks. They have conducted many studies, and it is safe.
Okay,
so
sir.
what I think breeders suggest it is 5 ml per liter. I've seen many.
Yeah,
So
I had 5 ml. That's what I asked again and again.
That is also fine. Sometimes if the amount goes high, it will be very sore. So it will be very difficult for them to drink. Maybe that's the reason.
Consuming is very less, maybe. Yeah.
Palatability will be very less.
Okay. Thank you. Thank you very much.
Okay.
I think one guy pinged, right? Abhijit had a yellow cornea which had bacterial infection conjunctives. So after giving antibiotic by means of injection by veterinarian, then constantly the eyes still continued to have discharge. Yeah, Abhijit, you can ask Abhijit.
Abhijit, you can talk to me if it's possible, because have you done? Are you sure about this bacterial infection? Which species of infection? Which is a causative agent? You did.
Sir, it's like the bird is not alive now. It's like 4 months or 5 months before.
So you have done cultural sensitivity. You have taken corneal swab.
Not like that, sir. I didn't. I was a beginner in that stage. So I went to the veterinarian. He said it's just an bacterial infection. It can be cured with injection continuously for 3 days. So I injected with 3 days with him. He injected. He said it's giving a good
response also.
But after that also, after 1 week, it came after that.
That's what I said. The organism might not be what may not be responding to the medicine. So it had showed that at the time of the medication, it had showed result because it is resistant. So the activities has reduced, but it is not completely cured. So it might have recurred again. So it may be the case of antibiotic resistance, I believe. If antibiotic sensitivity has been done, it can be ruled out. I think it's a case of antibiotic sensitivity. Antibiotic resistance.
Oh, okay. What's the perfect cure for that, sir?
That's what I said. If it is an infection, go for culture. Corneal Swab culture is there. So advise the veterinarian also. You can also suggest him, sir, can you go for cultural sensitivity so that we will know what the cause is, so that I can keep the record. It's better to not to what. It's a matter of ego.
It's nice to know the information.
Not question, just give him a polite reply that, sir, I need to keep a history of what the problem is so that I can improve later on. So for that, keeping this history, please do cultural sensitivity. So he will also get knowledge about it. So if you are from a remote area, he will also have a knowledge about the eye infections and the infection that is prevalent, that is common in your area, right? So that will help you also. So insist him or please give a good contact with him, and in the next time get a corneal swab also.
Okay, sir. And also, sir, after that, that bird had that fatty liver problem also. And also, after some time, it's like the bacterial infection came into action and the heads started to look down. And after 3 days, it passed away.
So I think the nutrition is also not proper. So please check that also.
Oh,
what you're giving. I think you're giving too much of sunflower seed, or the bird is eating only sunflower seed. Sunflower or safflower.
Yes, sir, that's correct. That the fatty liver came after that eyesight problem, and I left it in that flight cage, and I treated it well for 1 week, and that problem has solved.
Oh.
After that, infection came, I think. Does
Oh.
that have any connection with that eye problem?
That's it. Everything, every factors predisposes. Means if you're not good enough with your health, means your nutrition, there are chances
Right.
that you can get many diseases, right?
Okay,
So
sir.
especially viral infections, if you're talking about, you need good nutrition. So your body will definitely act against it. So even if you're infected with corona, what they advise is not antiviral drugs or any other drugs. Only supportive drugs are being given. I'm not talking about the extreme cases. In the
Yes.
normal cases, so they suggest good nutrition only. So that's what I also suggest. You must be very confident about your nutrition.
Okay, so okay. Thank you,
Oh,
thank you, thank
okay.
Yeah. Another doubt is like one of my friends aviary, like one friend aviary, the ALB is one, ALB is there. That left side eye is like completely bulged, and the bird is very active. Anyway, it's like cured actually, almost 1 or 2 months. Still, that it's completely bulged, but the bird able to breed, and it's a female bird actually. It's able to lay egg, and so whether that disease will carry forward to chicks also.
That is it able to see? Is it blind unilaterally?
Yeah,
That eye is not.
one side eye, one side eye is completely bulged and it's closed actually. Only one eye is open. It's working.
It is closed.
Yeah, completely closed. But the bird is very active, and it's able to breed. So whether that will, that will, the chicks also will get affected in that scenario.
I think that is an acute infection. Most probably, it will not affect the chicks. Probably, it won't affect.
Okay. Okay. James, yeah, you can ask them.
Yeah, hi, this is James here. Actually, my aviary got affected by pox 2 years ago. Many stock were dead and many were recovered. So far, it's been 2 years, and so far no other symptoms of pox. My question is, will there be any uh, possibility of pox again in the
No, no,
stocks?
no. Unless and until you get purchase or there is a chance of source of infection, there is no chance for infection. If you
Okay,
get
what happened? Okay,
if
what
you get
happened was my
uh,
aviary was neat only. I purchased a bird from one place, and mistakenly I took it directly to my aviary without
quarantining.
what is that, isolation and quarantine thing. So what happened was pox got spread to my stock also.
Oh.
Now all the birds are neat and good, but yeah, that's what I'm asking.
No, if you are not going to get any birds, there is no chance that you will get infection. And if it is free
Okay,
of this mosquito and all, sometimes
super,
that
super.
can happen because I've seen in areas where there is too much of pigeon population. So that
Okay,
infected even from infected pigeons, that mosquito bite may cause problem. So the
okay.
incident was that he didn't procure any birds for about 1 year, but still he got
Oh,
pox. But the problem was that of a pigeon, because there were
okay,
feral pigeons outside. So mosquito bite from that feral pigeon caused this infection. So excluding that, there is a rare chance you may not get if it is
okay,
it's a good area. If you
okay,
don't
fine.
buy an infected stock,
Oh,
definitely everyone will not be affected again.
okay, okay. Actually, and I'm also planning for an integrated farming setup where I'm going to keep various varieties of birds, which includes pigeons varieties and other exotic birds such as African lovebird, cockatiels, and mutants of finches also. How can I protect that aviary from any other infection? Say now I'm having just a small setup with around 20 to 30 pairs only, but I'm
Absolutely.
planning for a large setup. So how can I safeguard them and maintain that clearly?
So first of all, I need to know you're giving separate cages for separate breeds of birds, right? You're
Okay.
not planning to keep it in one aviary as a colony system.
Okay, okay.
So
So
what
what is
I'm
your
telling is
land square feet?
Land. It's an empty land. Actually, it's a farm where I'm going to have some setup in that blue sheet setup.
my opinion is we have got area to separate aviaries. Aviaries for separate for finches, separate for pigeons, and it's possible separate for other birds. You can keep birds
Okay.
inside one aviary if it is of same family. That is like parrots. You can keep parrots
Uh,
inside the same aviary, no problem. But
okay.
better not to
The gap between these aviaries, how much should I leave?
as far as possible is what I advise. At least if it possible, minimum should be 10 meter.
10 meter. Okay, fine, sir. That's it, I think. Thank
Then
you.
always keep a quarantine shed also. Keep it in the quarantine shed for some time. Then only get it to your main aviary.
Okay.
So the problem, what is going to affect is that the pigeon is one thing that causes infection, that brings infection, and African lovebird is another group of birds that cause many infections, and
Hmm.
cockatiels. So if I'm talking about conures, I will not be so confused because they are resistant to most of the diseases for conures and other birds. But just small birds like Africans, finches, and pigeons, they usually bring so many diseases. So make sure you get
Okay.
some good source.
Okay, fine, sir. And
Okay,
one more thing. Sorry, I'm taking more time.
it's fine.
Now we are facing a repeated change in the climate and atmosphere. Um,
Mm.
uh, Once it is heavy sun, or else it is rain. So the temperature used to get changing rapidly, say from hotter to colder. Will that affect the aviary? Because I'm checking it day to day.
Because yes, there is a chance for that to affect, especially respiratory infections. There is a chance you may get.
How can I prevent from that?
So that you will have to use what artificial means. If it is too hot, means you will have to use some kind of methods to
Exhaust fan.
reduce the temperature. Always make it
Okay.
ideal. I think it is always better to keep the temperature below 20, below 30 at least.
Oh, actually, the temperature is average from 32 to 35.
35. Okay, that is too much. So if it
Yeah.
when there is changing climate, there it will be so much difference will be there. It will go below
Okay.
28. So it's
Yeah.
ideal. That's what it is said. It is ideal to keep it in 28 degrees Celsius or lower.
Okay.
So for
During
that, you
winter
can
season, I
addition.
used to have a heat lamp with a warm light, which preserve the heatness in the aviary. But in summer time, I don't know what to do to lower the temperature. So I used to keep the door open and switch the fan on. So the temperature will get reduced by 2 degrees Celsius like that.
There are many methods, especially if you know someone from Kerala, because they are using many methods because humidity is also high here. So it's very difficult to control both. So there are sheets, some reflectors are there that you can use over your roof. There are some
Okay.
reflectors. There are some kind of heat
Uh-huh.
heat absorbers or some kind of fan is there, just like a
Okay, okay.
that can also be used.
Yeah, I understand. They in industries they used to have, right?
Yes, sir. And over the roof you can also pour water also. If there is sprinkler or something over the roof you can use. And
Okay.
don't use that foggers or mist inside the aviary.
Okay,
This,
okay. Yeah, in recent days, many people used to have that mist sprayer inside the aviary.
because
Is it advisable?
that may cause some kind of problem because that may affect the respiratory condition. I
Okay.
fear that.
Okay, sir. Okay, sir.
Okay.
Okay, thank you. Thank you so much.
Guys, any other questions? Sir? Yeah, I think 8:30. You're also. Yeah. Take dinner now. Yeah. It's okay. So guys, so we can wind up, right?
Yes, we can.
Yeah. Okay. Thank you. Thank you, Tittu. Thanks for your time, valuable time.
Okay, thank you. Happy to be.
Yeah, we gathered a lot of information here. Thank you. That's a beginners, like we got a lot of information. Thank you.
It's about when giving new knowledge, right? It's always
Yeah.
common topics, common things. So just need to just give a knowledge about what are the things that it affects the birds. There are not just some one bacteria, two virus. It's like so many things. So for vets, it's very difficult to identify what is the cause and to treat. So we are ultimately the one. It is culprit, right? Why couldn't you understand this this condition? So it's not easy. There are so many causes. So just to give a knowledge, awareness about that. That's what I meant.
So
And if you get new items,
recently, like met many breeder actually, they're looking for labs to do the cultural test and all. So do you suggest like which one is good lab or anything?
I don't
Because
know whether the lab is good. I have seen that Pranidhi is doing right. Pranidhi and some new labs are there. Even that culture can be done in any. I'm talking about bacterial culture. Fungal, if you're doing that, can be fungal also. If that human lab I'm talking about, human lab, they are ready to do culture. That is the procedure is normal. The only thing is that whether they identify it correctly or not. For that, for interpretation, a vet can do. If it is a normal bacteria, because you can see many normal bacteria. If it's a normal or abnormal bacteria, so whether it's a doctor can decide. So let them give that report. That process.
So what process actually? Whether I need to consult first a veterinary and then only like after a subscription, like we have to do.
That's if you suspect a bacterial infection, say you will have some suspicion. Sometimes we have got options in that you can write that, you can add to that. So I am suspecting this disease. Go for this culture.
Yeah.
Or else you can go for simple cultures. The microbiologist or the person handling, he will know how to conduct a culture. They will segregate what type of animal organism if it is aerobic, that it requires air or not. So it is producing this kind of enzyme or not. Based on that, they will segregate into different classification and give and ultimately find what the causative organism is.
Fine.
So it is a normal procedure. You can rely on normal human labs, good one, good human labs.
Okay. Amal, you asked something. Don't you can.
No, nothing. I just wanted to thank Tittu. That's it. I mistakenly raised that.
Okay.
Thank you, Tittu. Thank you.
Oh, thank you, Malata. Thank you.
Thanks. Thanks, Axel. We can close the call then. Yeah.
Okay, thank you. And always happy. I'm very happy to be part of BKSA, and I'm looking forward to work with you guys. We'll see in future also.
Sure. We are really proud to have you in the BKSA. Thank you.
Okay. Thank you.
Thank you. Bye.
Thank you, doctor. I learned a lot in today's session. Thank you.
Okay, thank you. Thanks for hearing that. Thank you.
Thank you.